Welcome back, class. I haven't done a video in a while, and I thought it's a good time to touch base with you and to see how everyone is doing in the second full week of our very short semester together. I hope all are doing well, and I hope that you are taking care of yourself. One thing I've been thinking about is how college life can be stressful, right? Being a student is certainly stressful, and right now during the pandemic, I know that this must be difficult for everyone. As I've said before, I know that this is kind of a taxing time on people's mental health in general, and I can imagine being a student is adding more stress to that. Some of you also are probably working extra hours at jobs. Maybe you've actually taken over for a family member who can't work right now. So we are thinking about you. I'm thinking about professors as stressors, right? Professors are also adding more stress to you. We're giving you deadlines and things to do and requirements, lots of readings. But I don't think that professors should be stressors. I think that we need to keep you on track, but we should also be people who inspire and support you. So I am trying to do that for you. I'm hoping you can hear the faint jazz music behind my voice here. Maybe that'll help you, and maybe you'll get to hear a bird or two singing out the window. Try to take care of yourself. Find ways to get out of your books, take a walk, and try to keep stress down for a lot of reasons. One is obviously to keep your health up and your immune system high so that you can hopefully stay away from this virus. I am grading your papers, your reflection papers, and I'm going to give you feedback. A couple of things to watch out for. Make sure that you're adding that writing memo. That is part of the writing requirements for writing intensive class. So some of you, I think, maybe forgot about the writing memo. Those of you who did it, they look good. I would just add that make sure you're reflecting on the writing process itself. Some of you are saying, here's how I made the decision about what topic to choose, which is fine. But the Writing Center also is asking you to think about how you're doing paragraphing, how you're choosing words. I don't know what else. Adjectives, nouns, subjects, varying your sentence structure, all kinds of ways that they want you to be thinking about writing as you're doing it, and revise and revise. If you revised your paper, talk about how you revised it. So that's just a little about the writing memo. It doesn't have to be long, but focus on the writing. Also, when you're choosing the research article that you are going to be writing about, because you've got one more of these, make sure it's a professor here in the sociology department at ECU. That was the assignment, to choose something written by a professor at ECU. That's why I sent you the link to all of our CVs so you can find our publications. For your next paper, you're going to do the exact same thing for Monday. You can choose the same professor's article if you wish. That might be a good way to do it. Or you can choose a different article. A different article would give you the chance to get to know somebody else's research or the same professor's research on something different. So this time what you're going to do is you're going to choose the research method that professor used, but you're going to do it on a different subject of your choice. So let's say that you chose Dr. Knox's research on, I don't know, marital breakdown, and it was based on surveys, right? So you said, okay, I'm going to use the same method of surveys and maybe the same population that he used in that survey, but I'm going to ask them about hookup culture on campus or something else. It could even be, I'm going to look at race differences in the hospital when somebody's getting COVID treatment. So again, you're going to choose a research paper by one of the professors in our Department of Sociology, and you're going to use their method, but a different subject. I'm glad to answer questions about that. Remember that Monday, you've also got a deadline to tell me what research project, the topic you're going to use. Make sure that you look at that list of 3 things you have to choose within those 3 topics, but you have to narrow it down. So don't give me a broad topic like, I'm going to look at race issues during a previous pandemic. See if you can narrow it down even further. So that means you're going to need to start doing some review of the literature. Go into our library website, and I don't know where else, Library of Congress, wherever you'd like to go, and start to look for articles and books that are on a particular topic. You might try Google Scholar. That's another good source. So start doing some surfing and see what's available out there. And I'm asking you to find sociological research on a previous pandemic, if that's the topic that you choose, one of the 3. It could also be anthropological research, but I'm mainly not looking for history per se. So I've given you a couple of articles to read for tomorrow about the previous pandemic that are more what we call social history. But I'd like for you to find something that is using, even though social history is a sociological method, I'm looking for something else that perhaps is going to do more at sort of investigating some sociological questions like social class differences or race differences, or let's say relationships between institutions like the medical institution and in politics, for example. So think that through. And again, I'm happy to talk to you about it. And I've got office hours on the discussion board tomorrow, Thursday, from 10 to 12. But I can also talk with you over email, or we can have a Skype discussion. I'm very open to that. And I look forward to it. I'd love to talk to you about your ideas. The issues of healthcare that we're talking about today is something that is obviously very sociological. As you read these various articles today, look at the ways in which we need to think about health, not only from a medical perspective, but from a social science perspective. And so if healthcare was not on somebody's radar as a sociology student or a sociology professor or researcher, it certainly is now, right? And so our pandemic that we're in the middle of is raising so many questions. In fact, I've never seen sociologists more quoted in the news than right now. I think more so than the medical professionals. So this is an ideal lead-in to our discussions tomorrow about the 1918 flu pandemic. And those articles actually will be a good background. You might want to read those if you're thinking about a research topic that is related to an earlier pandemic. These articles might get you thinking about that topic. So a lead up to today's discussions in my PowerPoint, I've got basically what I've done is I've embedded a lot of audio for you. So for each of the articles that you read in your book, there's going to be an audio there, file for you. And as you read and think about what you've read, some of the questions there are, what is sociological about healthcare? What's sociological about the medical field? Think about the array of settings that we are reading about for today and the issues, genetic birth issues, PTSD, breastfeeding. What about issues of how do you negotiate with your healthcare provider? And is that different depending on whether you are in the middle class versus the working class, right? Or poor. How is the medical profession responding to patient advocacy to change terminology, recommendations, treatment, or not? And does social class and race matter in terms of that kind of advocacy work? One of the terms that you read about in one of your articles is cultural health capital. And I wanted to give you a little background on that term capital and how it's being used in sociology today. It was a term I think I've mentioned before that Pierre Bourdieu actually introduced into the sociological field, not the word capital. The word capital's been there for a long time, but he started writing about how there are different types of capital, not just economic capital, but just like you might have a variety of levels of capital, of money, you can have in society a variety of levels of other types of capital. So he talks about social capital. What does it mean to have more advantages in society? Some kind of social capital that could be based on your education and your experience and other types of variables. What does it mean to have what he calls cultural capital? And that is some kind of cultural knowledge. And this often comes with your social class background, that you have knowledge of. You may have grown up in a family that had a lot of knowledge of opera history and opera stories and how to listen to opera, how to understand it, right? You may have grown up in a family that taught you about jazz and what kinds of leaders there are in the jazz world and who's the best saxophonist, right? So this idea of cultural capital is something that builds, that grows, kind of like money, and then gives you certain types of advantages depending on the context. So in this context, they're talking about cultural health capital, and that is, what does it mean to be, for example, negotiating for a family member in the midst of some kind of a medical treatment, medical crisis, when maybe you've got let's say you have a background in medicine yourself, or maybe you have a college degree so you can read the medical journals, or perhaps you have had experience, all kinds of things, like as some kind of a director of a hospital. So there are ways in which some people are coming in with more cultural health capital and therefore can be more of an advocate for the patient than they may have been if they didn't have that. So, very interesting term. Just some ideas that relate to what we're talking about today. I remember seeing probably in March or April, one of the first patients to die of COVID in New York City. And there was a very long, very irate video by an African-American woman telling the story of her sister, African-American sister, who had gone to a hospital, gone and asked for a test, asked for some kind of treatment because she was feeling ill, and she was very ill. The hospital sent her home, and she ended up dying of COVID because she did not get treated early enough. And this sister of hers was extremely, of course, she was in mourning, but she was also angry and felt that there was a racial bias in terms of who was getting treated, who was getting taken seriously by the hospitals. So we're hearing a lot about disparities in healthcare right now related to COVID, and has a lot to do with a variety of things, right? That people of African descent and especially Latino descent are on the front lines out there. They are working in the healthcare fields or in low-wage jobs where they have to be doing some kind of patient or customer service. They're also working close together in meat packing factories, possibly farm labor where they are at higher risk. They are also less likely, people of working class backgrounds and poor Black backgrounds are less likely to have the resources to be able to work from home like I can do and like you can do as a student. So there are ways in which not only are people catching the virus based on some kind of disadvantaged status in our stratification system, but also how it is possibly keeping them from getting the care that they need, and they're more likely to die, unfortunately. So much to think about related to health and healthcare today. With that, I look forward to working with you for the rest of the week, and see you soon.